I'm going to give you a little background about what I do and how I came to be where I am today with the stem cells. When I did my internship, I was very interested in hormones and in fat and in diabetes and just obesity. Then I did my dermatology residency, and that's a lot involved with fat as well. And there's a lot of diseases and a lot of surgeries that were done with fat. And I looked at how people did different surgeries, and when I did my cosmetic surgery fellowship, we obviously learned all the traditional ways of doing surgery, and we learned from different teachers and from different doctors how they would do their treatments. And one of the treatments that I was really fascinated by was the fat grafting treatments. The fat grafting treatments have a poor reputation in the old days because a lot of the times the fat that was injected wasn't being taken very well into the body. And they would last 3 months or so, and then it would go. Or they would get very poor results, and people didn't like it. During my training, I learned that there's different ways of doing it. And one of the ways that we decided in my practice that it's more acceptable to me was to manipulate the tissues the least. So a lot of people took this fat out of the body and put it into the sieve, and they would put it into gauze, they would wash it, they would do all these things to it, and then they would put it back in and they wouldn't get good results. What we decided to do was not to do that, to take it out of the body, keep it into the syringe, and then inject it back. And during the last 10, 15 years that I've been doing this, I got much better results than my colleagues who were not doing that. 5 years ago, I figured out why. The reason that my fat was doing better and the way we were doing it, we were keeping the stem cells and we were injecting it. So we weren't getting rid of it by washing it away. So the stem cells were kept and were re-injected. So when we figured out that that's why our fat is taking better, I just went one step further. I said, why don't we just take the stem cells and double them, triple them, and inject it back to get the results. At the same time, we were using fibroblasts for doing grafts for wound care and for diabetes ulcers, and we did the same thing. We switched it from fibroblasts to stem cells from the fat. The stem cells from the fat are very unique. They're the most concentrated amount of stem cells of any body part. They are able to do many things that other stem cells are not able to do. They're able to become muscle, bone, cartilage. They're able to become the sheaths around the nerve endings without us having to manipulate them in the laboratory. That's how they're programmed genetically. That's how we're made. And the stem cells from other body parts, like the blood, the cord blood, they're not able to do the same thing. They generally become blood-derived products. So when we took these and we put it on the wounds, we saw that the wound is healing and the skin is getting better. And when we started doing the stem cell lift and we doubled and tripled our stem cells, we also saw that the skin was getting better. And let me show you some of these pictures so you see why it works. And then I'll talk about how this translated into what Juvenes is and why it works. Trying to get that. Okay, so here's someone who's lost volume in their face. A lot of times in the old days, we used to think, oh, this is because she's got bags under her eyes. Well, everybody has bags under their eyes because that's the fat that supports your eyeball, okay? When we change our weight, when we lose weight, when we age, we lose this fat on our cheeks, and then that fat under the eyes protrude a lot more. The concepts are changing in cosmetic surgery. It's not just pulling and making things tighter, but filling and making it more volume, giving it the youthful look. And when you do that, you transform this person into a much younger, healthier looking person. This is 12 days out. So she's not bruised, she's able to go out, she's able to do things that she would normally do. You were not able to do this with traditional surgery. She would need an eye surgery, she would need a cheek implant, a lot of things that we don't do anymore. So the stem cells are just starting to work. It's going to take about 3 months for those stem cells to incorporate into the tissues and to continue to give her improvement. Here's another patient, and she's got a lot of hollowness here. She's an avid runner. She's a marathon runner. She has lost a lot of the volume in her face because she's just very athletic. So when you put it back in 4 days later, she looks much more youthful. And if you look at her nose and you look at her lips, which I didn't actually touch, the proportions have changed, and she looks a lot more balanced. The proportions to her nose and cheeks makes her nose look smaller, but we didn't really touch it. Here's someone who had a facelift 10 years ago. They didn't like the way they looked. They were always on TV, but they were being told they look tired or they don't look as healthy or as young. And I put the stem cells here and here. And basically, again, I didn't touch her lips and I didn't touch her nose. And she's much more youthful and much better. And this is 2 years out. So she's gotten very good results. She looks very natural. You wouldn't